Hello. I am sorry to have kept you waiting.
Oh, your nurse was rude to me when I asked how much longer you're going to be, but that's all right.
Well, if she was rude to you, that's certainly not okay. Again, I'm sorry. How are you feeling today?
Well, as I explained on the phone to your assistant or whoever that was, I'm in chronic pain, myofascial pain syndrome.
Okay.
I was diagnosed several years ago.
Uh-huh. I see that in your chart, and I also see that you left messages after hours. Let's see here. So according to our records, your prescription for oxycodone isn't due to be refilled by your family physician for another week.
Yeah, I completely understand that. However, the 15 milligram dose of Oxycontin is really the only dose that helps.
Are you currently on any other medications?
I've been asked that so many times. An inhaler for my asthma, not that that's
Okay.
really a pill. Occasionally Advil, Claritin, but no other pills than that.
Did you run out of your oxycodone?
Yes.
I see there were 30 pills in your prescription.
Yes, but my doctor said that I could call in for more if we needed to.
And did you call in for more?
Yes.
How many more?
15? Another 15?
And then did Dr. Wade prescribe the 15 more?
Yes, she did.
Was that enough to last you for the month?
No, it was not.
So what did you do when you ran out?
Suffered with the pain,
Oh.
and then called in and asked for another prescription, and then came here to see you.
Have there been other times that you ran out of your prescription?
No, running out happened only just once.
Okay.
But that was only because Dr. Wade wanted to do a trial on me on a low dose.
Trial.
Yeah, and she said she thought the pain would go away before the prescription ran out, but unfortunately it didn't. So it wasn't like I overused my pills.
So did she say you could call in for more if you ran out?
Yes, she did. What I said.
Oh, so that wouldn't then be a trial for the dosage?
No, but that was before, back when it first started. Different doctor.
Okay, I'm confused.
I'm sorry, because you're making me confused with your questions.
Okay. Can you explain? I'll do my very best to follow.
Okay. Before,
Okay.
back when I first started, it was a trial dosage.
Okay.
Yeah, and then when they got the dosage right, they let me refill the prescriptions when they ran out.
Now, was that Dr. Wade or another doctor?
Oh God. I'm sorry. Just let me think. I'm sorry. I'm fucking terrible with names.
Do you ever take pills from a prescription that isn't yours?
No. I mean, in high school I would piggyback on a friend's Adderall, but that was, everyone did that. High school kids.
Tell me about your myofascial pain. What are your symptoms?
Pain. I mean, mainly in my neck, shoulders. Here, like it's sharp and persistent. Like it lingers for days.
Well, that sounds uncomfortable. Does that ever affect your sleeping?
Yes, always. I mean, it's impossible to sleep. When you can't lie in one spot for more than 5 minutes without
Right.
a shooting pang in your trigger points, you seriously just can't sleep. I wind up watching TV on the couch for just until I fall asleep, which makes my neck and shoulders hurt worse in the morning.
How do you feel after you've taken the oxycodone?
That's just the difference between night and day. More
Okay.
relaxed, muscle pain just melts away. It gets rid of the pain, but I don't feel, like it takes over me. You know what I mean? I can be able to work, able to sleep, I can hang out with friends. I mean, sometimes it's a bit of a roller coaster, but I don't know. I'm sorry. What did you ask?
Do you take the oxycodone on days you don't have pain?
I might. I don't want to be at work and then suddenly the pain kicks in and stops me from working.
Have you tried to stop taking your pain medication, get all the way off of it?
There have been weeks where, 1 or 2 weeks where I've not taken it, but it's not like I've been trying to get all the way off it, if that's what you're asking.
Yeah, why is that you haven't tried to stop?
I felt fine, like I was, taking my meds.
What kind of stresses do you have at work or at home?
I live alone, so no stress there. At work, I'm an office assistant, so sometimes I have to do a lot of filing, which just exacerbates the pain to the point where it just shoots through my neck, especially when I'm, bent over on the floor, just going
Right.
through one filing cabinet after another. And I just stopped wearing heels. Not just, it helped like a bit, but it's not like I'm going to quit my job or anything. I have to have money. It's not like there's anything out there for me,
Why do you think that?
College dropout. That's a long story.
When you take the oxycodone during the day, do you feel it has any effect on your work?
Well, there have been days, where I've had to call out for work, but that was because of the pain, not the oxys.
For the pain, okay.
Right, exactly. I can't even like get up from out of bed. The pain gets so bad in the morning, like especially when I've been on my feet all day long the day before. But the prescription that I'm on really helps.
How many times a day are you taking the 15 milligrams?
Just like the doctor said, one in the morning, one again later.
Mm-hmm. I checked your records. I see here that you've visited several other doctors and requested the same prescription from them. You currently have 2 additional prescriptions for oxycodone.
Well, oxy is what helps me.
Mm-hmm. Well, I had my assistant make a few calls and learned that I'm the 5th doctor you've seen in the last 2 days.
Well, everyone else is so damn unhelpful. Like your rude nurse over there who made me wait for no good reason.
Have you ever lost your prescription before?
No, I have never lost my prescription. I have run out once.
Uh-huh.
Like I already told you, okay? But that was just because, I was doing a trial on a low dosage, and the doctor thought that the pain would go away before the prescription ran out, but it didn't.
Mm-hmm.
Okay?
Okay.
So it wasn't like I was overusing my oxys.
Have you ever tried anything like physical therapy? I see it was recommended for you.
Yeah. Okay, I'm supposed to exercise, all right? But no, I didn't complete PT. I started, and then I stopped, all right? I didn't like the guy. He was pushy and rude, and he blamed me, all right, saying that I wasn't trying, when I actually was trying as hard as I could. But he was like some freaking drill instructor. You know those guys in the Army that yell? And I'm sorry, but I did not sign up for getting yelled at.
That's unfortunate that you had a bad experience. So we could always, find another physical therapist. It really can help people who have this sort of pain you're describing.
You don't know that, all right? And I told you, I am done with PT. I know what works for me and doesn't.
Have you tried any acupuncture or massage therapy?
I'm adverse to needles, so no. And massage therapy, once,
Okay.
but my insurance refused to cover that, so no to that too.
Now, how many times do you take the oxycodone in a day?
As instructed.
Which is
2, 3 times, depends.
on your pain level?
Exactly.
Do you experience any side effects from the medication, like dizziness, anxiety, confusion, having accidents?
Sometimes I get the dizziness, but none of those other things relate to me.
Have any friends or family members suggested that you cut back on the amount you're taking?
Why? They see it works. They love me. They want me to feel better.
Do you drive at all after taking oxycodone?
I take the bus to work.
Do you drink any alcohol or use any other substances?
I'm sorry, but are all of these questions really necessary?
Well, this is information I need to know.
No, I don't use substances. And yes, I drink sometimes, okay? But it's not like I drink while I'm taking oxys. I know better than to do that. I'm not stupid.
Have you ever been to any drug or alcohol treatment facilities?
No.
Any arrest for drugs or alcohol?
These are a lot of questions for a freaking prescription. It's like, I'm not applying for a job here, okay? You're just getting a little too personal. All right, and no to your question, all right? I'm not a criminal.
I didn't mean to imply that. But I do have some more questions before we can start talking about your prescription.
Sure. Shoot.
When you take oxycodone, do you swallow the pill or use some other method for taking it?
Why would you even ask that?
Well, some people I see have other methods they feel are more effective when they take a pill like oxycodone.
And these other methods are what?
Well, there's usually a right way of taking a pill and a wrong way. There can be very severe side effects to taking it one way versus another.
It's a pill, for God. I mean, you swallow it, okay? I mean, sometimes I crush it or chew it.